So, 5 viruses can cause hepatitis. Hepatitis A, B, C, D, E. And before we will talk about all of them, we're gonna underline some differences and some common features of all of them. First of all, we can divide all of them in 2 groups by the way of transmission, according to the mechanism of transmission. Hepatitis A and hepatitis E are viruses that spread by fecal-oral mechanism of transmission. Hepatitis A and hepatitis E. Hepatitis B, C, D are spread through the parenteral mechanism of transmission, through the blood. That means all hepatitis, hepatitis that spread through the blood are transmissive infections, and at the same time are sexually transmitted infections. Another difference what is in common between hepatitis? Basically, why do we have different viral infections of different organs or systems? So, there is a virus that affects liver. And this virus spreads through the blood. Why it affects specifically liver? Because we have another virus that also spreads through the blood but affects immune system. We have another virus that spreads through the blood but it affects central nervous system, and so on. Why different viruses affect different organs and different systems?
Maybe because some viruses they need special environment and they have special receptors in this environment.
Special receptors, yes. When we are talking about viruses, we shouldn't forget it is mandatory intracellular parasite, and by special environment we should mean special cell. So not every virus can penetrate any cell. This is why we have hepatoviruses that can cause hepatitis. This is why we have bacteriophages that can affect just bacteria and just specific species of bacteria or families. And there are also viruses, but they have affinity. They can fit only with specific type of cell. How it happens? They have affinity to specific type of cell. Very easy, very simply, because this virus is produced by this very cell. How it happens? The genetical material of the virus will get inside of the cell. The cell will change its function and will start producing viruses. And on the last stage of viral production, the cell will give its own particles for coating of the virus. So on the exit from the cell, when virus becomes virion, it becomes a coated virus, it gets particle of the cell. So next time it will come to another cell from this tissue or from this organ system. The receptive cell will recognize this virus as proper material. This is how viral infection happens in any case. So any virus contains its own genetical material and coating, that is capsid, supercapsid, envelope. Different viruses are enveloped or non-enveloped viruses. So this package for genetical material of virus is made of particles of previously infected cells. This is why virus is recognized as partially as a proper material. Of course,
It's like a way of adapting.
yes, right. But still, it has something different from this cell, because otherwise antibodies wouldn't be produced against viruses. So it has some own antigens, and it has some own protein substances from the cell. This is how infection is possible, and this is how antibody production is possible. If we are talking about fecal-oral transmission of hepatitis A and hepatitis E, there is something in common, way of transmission. So some viruses can get in our body through the gastrointestinal tract, and they will get in the liver through intestinal tract, and some viruses will come through the blood. If we are talking about hepatitis A, and I would like you to pay attention, when you compare taxonomy of different viruses, viruses that cause hepatitis, usually we need family, genus, species, right? So you can observe that all hepatitis are caused by absolutely different families of viruses. For example, hepatitis A is caused by family Picornaviridae, genus hepatovirus, and species hepatovirus A. If we are talking about hepatitis B, please pay attention. Family is Hepadnaviridae. The first one is Picornaviridae. And here family is Hepadnaviridae, and species is hepatitis B virus. If we are talking about hepatitis C virus, you can see it. Family is Flaviviridae. So there is nothing in common between these viruses as a region. Flaviviridae. And genus is Hepachivirus, and species Hepachivirus C. Talking about hepatitis D caused by Delta virus. Where is it? Family Deltaviridae, genus Delta virus, and species Hepatitis D virus. Also different family. And talking about hepatitis E, family Hepiviridae, and it is caused by orthohepivirus A. It is hepatitis E. Okay? So, it is not like in salmonellosis or shigellosis, yes? It is not like that. There are few similar pathogens making part of same family that can cause similar symptoms. They are spreading by similar ways and so on. Nothing, or if we are talking more general about intestinal infections, all of them are making part of same family but different genuses. So all of them somehow are relatives, or most of them somehow are relatives. They have similar origin. When we are talking about taxonomy and origin of viruses that cause hepatitis, they have absolutely different origin. But what is in common? They have affinity to the same cell, to the hepatocyte. So hepatitis A is specific by the fact it is spread from human to human. What does it mean? It is strictly anthropogenic infection. It affects only humans. In comparison with hepatitis E, it affects both animals and humans. Since it has a fecal-oral mechanism of transmission, that means the virus is eliminated in the environment with feces of infected person. Sometimes it can be a sick person, sometimes it can be a person without symptoms, infected person without symptoms that we call healthy carrier. Feces of infected person will get in the environment. Somehow foods or drinks, water, and so on can be contaminated with feces of infected person. After that are consumed by healthy receptive person. What does it mean? Person who is not vaccinated. Because talking about hepatitis A and E, we have vaccination against hepatitis A and E, so it can be prevented. But again, please keep in mind the infection with fecal-oral route of transmission are better prevented not by vaccination, but by proper hygiene and taking care about everything you consume. If it is drink, to make sure it is from a centralized source of drinking water. If it is food, make sure it is clean. If we are talking about fruits and vegetables, to make sure it is clean, it is not contaminated with soil. Some people have that bad habit to taste fruits or vegetables in market. So I'm pretty sure we have here some people who are tasting maybe grapes in the market or something, cherries. Yes, when the season is coming. But how can you buy it unless you know it's tasty or not? This is how they explain it. So, okay, if you want to taste it, take with you a bottle of water, take one, wash it, and you can taste it. But mostly interesting that there are some people who they are not tasting to check it out is it good or not to buy? They're going here, there, and they check everything from the entrance in the market till they leave it. So on the exit, they're already he is already full. He doesn't need to buy anything. Full of foods and pathogens.
The problem that we put or she puts her hand everywhere.
Yes. Yes, but because before you will taste it, you will choose the mostly good one. You know, you will not taste anything. You will not this one, not this one. Actually, yes, you're right. And even if for you it is something weird, for most of people it is not. That means for most of people, personal hygiene means nothing. That means such people probably do not wash their hands after bathroom, and so on. If such people have such habits, there is a high chance they would be sick or healthy carriers of hepatitis A or E. There is a chance. What else? And the mostly dangerous thing about hepatitis A and E, most of people pass through hepatitis A or E without any symptoms. So if you have symptoms, it is better for the society, not for you. For you, it is better just for one person. For me, as potentially infected person, it is better to have it without symptoms. Because I will get it, I will pass it through it without symptoms, and I feel good during the entire period. But for people with whom I am entering in contact directly or indirectly, it is very bad because I am the mostly dangerous source of infection. They cannot understand I am source of infection, and they are not aware about all the protection they could apply, but they don't, because they don't know I'm sick or I'm infected. This is why healthy carriers are more dangerous from epidemiological point of view than sick people. Now talking about symptoms, again, it is not that easy to detect person with hepatitis, and talking about any type of hepatitis. It is not that easy for few reasons. The mostly classical symptom of hepatitis is come on.
It's affecting the liver, it must be joint.
Yes.
Somehow.
So, jointness. That means yellowish color of skin and eyes. But there are two problems. First one, it is classical or typical symptom for hepatitis, but not mandatory.
Might be
Not every time it appears, this symptom. What does it mean? You will not observe it. So people with hepatitis A can have a symptom: stomach ache, vomiting, diarrhea. In this period, they actively eliminate virus in the environment. And if we have yellowish skin and eyes, okay, we can suppose it is hepatitis A or hepatitis E. But if this symptom is missing, you can misuse this infection with any other intestinal infection, with any escherichiosis, salmonellosis, shigellosis, and so on. And it will be spreaded as just as any other intestinal infection. Another issue that a very big part of population on the earth have dark skin. Do you know such population with dark skin? No? For example, if you don't know, I will let you know. For example, people in Africa, or maybe, for example, people in India, right? Have dark skin. You will not observe on the dark skin. Yes. This is why you should pay attention to a patient's eyes. So if sclera is yellowish, you should pay attention to it. By the way, sometimes I can see students with yellowish eyes. I'm not sure if they are aware about that or not. So think about it, and look better in your colleagues' eyes. Maybe you can save each other. So it is very important, because some symptoms that are classical for some people are not classical for others. For a simpler reason, they look different. That's it. There was a case. Young mother, after giving birth, have been that happy about her child. She posted few pictures of her child on the Facebook, and everybody have been, oh, so cute, it's so cute, oh, it looks so nice. And just one doctor told, did you pay attention to his eyes? Because the baby was with a dark skin. Did you pay attention to his eyes? Please check his liver. And it was on time. It was on time. This is why it is extremely important to make sure you prevent all the infections, including hepatitis, all types of hepatitis, especially during pregnancy. It's very important because it can cause huge issues for both mother and fetus, or mother and child. It depends on the stage. It is extremely important to pay attention to your health, especially before, during, and after pregnancy. It's very important. We will not stop for too long on lab investigation because it's classical for all of them, and it will be based on two main facts. First one, mechanism of transmission, and second one, serological and biochemical investigation. When we are talking about when we are talking about mechanism of transmission, you can find viruses in case of hepatitis A and E. You can find viruses in feces. You shouldn't forget about it. So, antigenic test, if you want to do it, you make from feces. Talking about detection of virus, also you can all the time find it in blood. Not for too often biopsy can be made, but usually it is not needed. Liver biopsy, but just if it is extremely indicated for specialist, the infection disease specialist know specifically when and why we need to make biopsy. But basically that's enough to take hepatitis A and E feces for detection of viruses, or blood for both detection of virus and detection of antibodies. And blood for biochemical test. Usually usually it starts with biochemical test. When somebody has some deviations in work of liver, first signs of this deviation will be a SAT in biochemical test. These are parameters of liver working. So here you can see it. So biochemical test will show you any issues with liver, and after that, to specify which type of virus we have, we make more specific investigation. And usually, if you detected hepatitis, probably you already have not just virus but also antibodies. Almost no one detects infection with hepatitis on the early stage. This is why usually you will already detect both virus and antibodies against this virus. Hepatitis A and E are treated easily. By easily, I mean most of cases will have favorable dynamic, a favorable prognosis. So you probably know people who supported hepatitis A. I know a lot of people, especially about 30, 40 years ago. A lot of people used to get infected just by mostly spread case by tasting fruits or vegetables in the market. The mostly popular case. But all of them passed through this infection somehow, and they're healthy now. When we are talking about so for prevention, we told hygiene, vaccination. It does exist, but it is recommended for endemic regions. So if hepatitis A virus is circulating in your region, it is highly recommended not only personal hygiene habits, improving of personal hygiene habits, but also vaccination. If it is not endemic for your region, vaccination is not needed. Actually, it is not indicated. It is important to have this balanced approach for vaccination, balanced approach for prevention, for treatment, and so on.
It's making a pressure on the companies that are making vaccines.
Yes.
For example, they have to produce for countries that in need for this.
Right.
They're consuming simply.
Right. And actually, in different situations, vaccine either is very good and needed, is important, either just as you wish. You want extra protection, you're gonna go in the region with where it circulates. For example, you're gonna go in Africa where malaria circulates. So for this very reason, you get some preventional treatment for malaria. Otherwise, you don't get it any day, just in case. Just because we also have mosquitoes, yes, but they're not spreading malaria. Same thing. If you need it, you apply it. If not really, not needed. Talking about hepatitis B virus, it is very important to know that doctors are in the risk group with any type of blood spreading virus, hepatitis. Hepatitis B, C, D we are in the group in the risk group of infection. If you're gonna work as a nurse, if you're gonna work as a doctor, your risk to get infected is much higher. However, even if, for example, I'm a doctor, I'm working for about 7 years, I didn't ever have a contact with patient's blood because my specialty is a little bit different. Am I in the group of risk? Not really, even if I'm a doctor. But from time to time I visit dentist. From time to time I get some treatment with injection, like if I get sick and some antibiotics are administered, or anyone passes through such invasive procedures like injections, like or I'm giving blood sometimes, I'm donating blood sometimes. So these are vulnerable moments that make anyone exposed to the risk. This is why, of course, since doctors and nurses, especially surgeons and nurses, are having daily contact with the patient's blood, they have a higher risk. Others, anyone from general population, my risk is similar to a general population somehow. This is why I'm not in that big risk, but still, as soon as I have opportunity to get vaccinated, but by the way, recently I've got this opportunity, soon I will get vaccinated against hepatitis B. Just because everything can happen in this life. So, as long as you have opportunity, especially as doctors, as long as you have opportunity to get any form of protection, you must do it. Highly recommended.
Even during the summer practice, the doctors were
Right.
wearing us like, be careful with the after injection syringe because you might.
Right. That's right, and it is very important. Everything is impossible. It is absolutely right. For you, it is important to keep in mind that most of accidents are happening maybe not in the first day of practice. Most of accidents are happening when you are already relaxed. So you start learning, you respect all the procedures, you respect all the protocols. There are some protocols for safety of injection safety protocol. So you never take a needle, you never put a cap on a needle with another hand. You take a needle, you take a cap with a needle, and after that you press it. So in order to not poke you, yes, to not make an accident on the during injection, and to not have contact with patient's blood, because you must keep in mind that every patient you ever have, you should treat as potentially infected with hepatitis B, C, D, with HIV, with any. You should treat anyone as it is potentially infected, because you never know. Even that patient, not everybody is aware about his status for now, because the patient can be simply in the last period of incubation. A lot of people who are aware about their status, they are HIV positive, or they have hepatitis B, C, D. They are aware about that, but they're that upset on life. They say, why should, or they are intimidated, and they don't want to let everybody know about their trouble without being aware about their responsibility about that. Either they say, why should suffer just? Why just I should suffer? Let others suffering also. So if I get infected, if I make infected anybody else, what's the problem? People are very different. So from this point of view, you should be aware about that, and you should do your best to protect yourself. All measures you can apply for protections are welcomed. So we have vaccine against hepatitis B. We don't have vaccine against hepatitis C. We don't really have vaccine against hepatitis D, but we do have vaccine against hepatitis B. When we are saying about hepatitis D, I will explain it later a little bit more detailed, but specifically against hepatitis B, we do have vaccine. This is why it is extremely important. As soon as you have this opportunity, I highly recommend you to get vaccinated against hepatitis B. Why do we have just against? Not because hepatitis B is more dangerous. I would say hepatitis C is more dangerous, but it is much more complicated to produce vaccine against it. Why don't we have vaccine against hepatitis D? We don't need it, and I will explain now why. But against hepatitis C, it is very hard to make vaccine. First. Second, it is much more severe as disease, as infection. About 80% of cases of hepatitis C are leading to hepatic cancer, are leading to cirrhosis, and as a result, of course, to early death. This is why it is a little bit easier to live with hepatitis B, even if we don't really have a treatment. You will live with hepatitis B probably forever if you get infected. This is why it is very important. We have supportive care. We can keep it on the level, kind like HIV maybe. But it is not that aggressive if you keep that supportive care. Meanwhile, hepatitis C is treatable. And I personally know a person who've been infected with hepatitis C after blood transfusion after surgery. And after that, he got treatment. I don't remember how long that treatment, it was against about a few months up to half a year, something like that, as well as I remember. So with completely, with 100% treatment, with positive result, with good result. This is why there is something that is more dangerous about hepatitis B, and there is something that is more dangerous about hepatitis C. So symptoms will be quite similar in all of them. B, C, D. Symptoms will be similar, and the way of transmission will be similar. We just need to detect specific virus we have in order to know what can we do to a patient. It is very important. And lab investigation, of course, will be similar. So in case of hepatitis B, we apply antiviral Also, it is very important to work with immune system, because whenever we have some systemic issues, when we have issues with liver, it's systemic issue. When we have issues with heart, circulatory, it is also systemic issue. With the respiratory system, systemic issue. Kidney, systemic issue. So liver filters all the entire contents of our blood. It is huge filter of our blood. So if it stops working properly, our blood is not filtered and it carries everything, all the metabolic results of our body. So normally they should be neutralized and eliminated from our body. If kidney are not working and eliminating extra substances from our blood, if liver is not working, it is systemic failure. It's systemic issue that is to be solved as soon as possible. This is why basically any in theory, any hepatitis can be resulted with cirrhosis, but basically the mostly spreaded one is hepatitis C. That is more aggressive. Meanwhile, not only cirrhosis can have not only viral origin. On the first place, cirrhosis is caused by toxic issues. First of all, alcohol and drugs. On the first place, alcohol and drugs, because liver has to filter all of these toxic substances person is consuming. This is why on the first place cirrhosis is toxic cirrhosis. And just after we will have viral cirrhosis with viral origin. Prevention, vaccination, and blood transfusion or medical precaution on any medical and any invasive procedure. So, talking about hepatitis C, we already discussed. But what is also very important to underline, about 70 up to 80% of infected people do not present any symptoms. It's very important also. This is why when you want to be a donor, when you want to donate some blood, it is very important you to be aware about all the potential risks you have as a donor. Like you can be infected on that moment, or you should be aware about all your contacts, all the risks you had recently to get infected, because you are giving your blood that could be potentially infected. So it is your responsibility, and the medical institution that receives the blood, their responsibility. Whoever gave a blood as a donor, did you ever? Whoever gave blood as a donor, did you observe that before they start taking blood in that bag, firstly they take 1 tube of blood. It is for investigations. So you sign the paper that you didn't have any dangerous contacts, you didn't have any surgeries for the last period, you are not you don't use drugs, You didn't practice any unsafe contacts with anyone, and so on. So you put a lot of X's like I didn't, I do. After that you sign it. So it is on your responsibility. It is based on your responsibility. But nobody should trust you. Because first, everybody lies, right? Second, not everybody keeps in mind everything. As well as I remember, maybe I don't remember what happened last weekend. So it is very important to not just to trust what you wrote on that paper, but also to make the mostly basic investigation. Is the quality of blood is good? If we do or don't have any pathogens in that blood, if everything is okay, you can give it to the patient. If not, you just lost 400 milliliters of blood. That's it. They will destroy it. They will throw it out and will not give to any patient. It is how it should be. But still, if you don't have symptoms like yellow skin or eyes, there are a few more symptoms that potentially will happen much more often. Is dark urine and light colored stools. Why? Because if you ever knew color of our urine and color of our stools, our feces, is almost all the time similar. It doesn't matter what we consume. Almost all the time has quite similar color. It doesn't mean what it doesn't matter what we consume. You know why? Because of pigments that are eliminated in the blood and in the intestinal tract from liver. So urine is yellow because of pigmentation that is eliminated through the blood and is produced by liver. And stools normally are quite brown because of pigmentation that is eliminated through the hepatic ducts in the duodenum that contains that pigmentation. So if we have some hepatic failure, some hepatic issues, the color of urine and stools will change because of deviation of direction of this pigment. This is why it is extremely important to pay attention, especially on color of urine and stools. Of course, if you consume some vegetables, for example, cabbage, yes, or no, not cabbage. I forgot it. Huh? No, the red one. I have to Google it. Yes, beets. So you can observe if you consume it. After that, color of feces will be extremely red. You can check it out right now. Not right now. These days. So there are some products that can influence color of your stools or urine, but if you didn't consume for last period these products, but the color is changed, you can think, you can start guessing some issues with liver or some issues with the gastrointestinal tract. Okay. Talking about hepatitis D. It is caused by Delta virus. And when I told you we don't have vaccine against hepatitis D, but we actually don't need it, here is the answer why. Hepatitis D is caused by Delta virus that is virus with a defected RNA. And this virus is not able to infect you unless you are infected with hepatitis B. So it is a kind of satellite of hepatitis B. There are two ways to get infected with hepatitis D. First one is co-infection, when the person gets blood. When I get blood from a person with both hepatitis B and D. In this case, the infection instantly will be double with hepatitis B and hepatitis D. And such hepatitis will be more aggressive as nosology, as disease. It will be more aggressive. It will be harder to provide supportive care to such person. Another way of infection, if a person with chronic hepatitis B, such people very often get treatment, also through injections. And there is a chance one day for them to get infected also with hepatitis D. This one is called superinfection. In first case, it is co-infection, two infections at the same time. In the second case, it is superinfection. It is extra infection. In such case, it will be a little bit easier than in case of co-infection. So, why don't we have any vaccine against hepatitis D? For a simple reason, we don't need it. Because if we prevent hepatitis B, by default we prevent hepatitis D. If I get vaccinated against hepatitis B and I will never get infected with hepatitis B, there is no chance for me to get infected with hepatitis D. This is why I told you we don't have the vaccine against hepatitis D, but we actually don't need it because we have prevention for hepatitis B. So whenever we are talking about prevention of hepatitis D, you just come back to prevention of hepatitis B. And everything you can answer about hepatitis B, prevention of hepatitis B, you answer in the you answer also for hepatitis D. Same, absolutely same prevention. So, if we compare these two viruses, hepatitis B virus is a virus with DNA. It is DNA virus. Hepatitis D is RNA viruses. So, just together, just if they meet each other, hepatitis D is able to replicate in the hepatocyte. So all symptoms and all lab. What is also very dangerous about hepatitis? Uh-huh. What is also very important to know about hepatitis D? Why it makes it makes to be dangerous. The person with hepatitis D, the person who already has hepatitis B is aware about its disease. So, if the person has just hepatitis B, this person is aware about the issue. And this person is not expecting to get any other infections. And if that person gets infected with hepatitis D, there is nothing new because you're already sick, you already have those symptoms. Sometimes it becomes worse, sometimes it becomes better, so you don't observe it. This is what is dangerous about superinfection, about any superinfection. It is about hepatitis, it is about respiratory tract infection, anything. When you get superinfection, you are not aware about this superinfection instantly. Usually you realize it when it is too late. Usually, very often. This is why for people with chronic hepatitis B, it is extremely important to make periodic checkup because they have more injections, they have more treatments, and they have more risk. They have higher risk to get infected with superinfection with hepatitis D. And in order to increase quality of life of such people, it is very important to make, from time to time, to make checkup for both, not just for the hepatitis B. And of course, don't forget about vaccination. And since we discussed about hepatitis A, in the end, just underlining a few differences between hepatitis A and hepatitis E. Even if hepatitis E is a little bit less aggressive, like in comparison with hepatitis A. What makes it a little bit more dangerous? Source of infection is not just human. As a source of infection, we have also animals. This is what can enlarge your opportunities for infection. This is why again and again and again, personal hygiene. All the precautions in drinking, in food consumption, in all your daily habits, because everything that spreads through the fecal-oral route, it is about daily habits, and you should pay attention to all the details of your daily habits. As more you will behave like a nerd in this direction, as less chances you have to get infected. As less you will pay attention, as more interesting will be your life.